What vaccination rate is required for herd immunity in children? Imagine a community where most children are protected from dangerous diseases. That's what herd immunity is all about. It happens when enough kids are vaccinated or immune, making it hard for the disease to spread. This protects everyone, especially those who can't get vaccinated, like babies or children with certain health conditions. But how many children need to be vaccinated to make this work? The answer depends on the disease. For measles, which is very contagious, about 95% of children need to be vaccinated to reach herd immunity. Measles spreads easily from person to person, so a high vaccination rate is essential. If fewer children are vaccinated, the disease can find ways to spread in communities. This can lead to outbreaks, especially in areas where many children are unvaccinated. Infants who are too young to get the vaccine, older children, and people with weakened immune systems relying on herd immunity for protection. When vaccination rates drop below this 95% mark, measles can quickly resurface. Polio is another serious childhood disease, but it requires a lower vaccination rate for herd immunity, around 80%. Different diseases have different thresholds because of how easily they spread and other factors. The goal is to keep enough children vaccinated so the disease cannot find enough hosts to keep spreading. Herd immunity doesn't just protect vaccinated children. It also shields those who cannot be vaccinated or for whom the vaccine isn't effective. When most children are immune, the disease has fewer chances to spread, which keeps entire communities safer. This is especially important for vulnerable children and adults who depend on community immunity for protection. In the United States, vaccination rates for some childhood vaccines have fallen below these critical levels. For example, in the 2020 0 to 5 school year, about 90.5% of kindergartners received the measles, mumps, and rubella vaccine. The dip in vaccination rates over the past few years means about 286,000 children in kindergarten are unprotected against measles. The rate of vaccine exemptions has also increased, with more families choosing not to vaccinate for personal or religious reasons. These pockets of unvaccinated children create opportunities for diseases to spread. The consequences of falling below herd immunity levels are serious. In 2025, the United States saw more measles cases in the first half of the year than in any year since 1992. Over 1,300 cases were reported across 39 states, with most children affected being unvaccinated or their vaccination status unknown. Many of these children were under 5 years old, a group that is especially vulnerable. Maintaining high vaccination rates is vital for protecting children from dangerous diseases. When vaccination coverage drops, diseases that were once under control can make a comeback. This puts all children at risk, especially those who cannot be vaccinated. Public health experts stress that vaccination isn't just about protecting your own child. It's about helping the whole community stay safe. When families choose to vaccinate, they help prevent outbreaks and protect the most vulnerable among us. Always talk to healthcare professionals for personalized advice, but staying up to date with recommended vaccines is key to keeping children safe and healthy.